Interstitial cystitis, often abbreviated as IC, is a chronic condition that causes bladder pressure, bladder pain, and sometimes pelvic pain. It can be a challenging disorder, as its symptoms often fluctuate and can be triggered by various factors. In this video, we'll explore the most common triggers for IC flare-ups, helping you better understand how to manage and potentially avoid them. Let's start by briefly understanding what IC is and why identifying triggers is so important for those living with this condition. One of the most significant categories of triggers for interstitial cystitis is diet. Many people with IC notice that certain foods and drinks can quickly lead to a flare-up of symptoms. These dietary triggers can vary from person to person, but there are some common culprits that tend to affect a large number of individuals. Understanding which foods and beverages might be problematic is a crucial step in managing IC and reducing discomfort. Acidic foods are among the most commonly reported triggers for IC. Items like tomatoes, citrus fruits, pineapples, and vinegar can irritate the bladder lining, leading to increased pain and urgency. Many people with IC find that reducing or eliminating these foods from their diet can significantly decrease the frequency and severity of their symptoms. It's important to pay attention to how your body reacts to these foods and adjust your diet accordingly. Spicy foods, such as those containing hot peppers, chili powder, or curry, are another frequent trigger for IC symptoms. The compounds that give these foods their heat can cause irritation in the bladder, leading to discomfort and increased urgency. If you notice that your symptoms worsen after eating spicy meals, consider opting for milder alternatives and monitoring your body's response. Caffeine is a well-known bladder irritant, and drinks like coffee, tea, and certain sodas can trigger IC flare-ups. Caffeine increases urine production and can make the bladder more sensitive, leading to pain and urgency. If you have IC, it may be helpful to limit or avoid caffeinated beverages and choose alternatives such as herbal teas or water. Alcohol is another substance that can irritate the bladder and worsen IC symptoms. Beer, wine, and spirits may all contribute to flare-ups, as alcohol can dehydrate the body and increase bladder sensitivity. If you notice a connection between alcohol consumption and your symptoms, consider reducing your intake or avoiding alcohol altogether to see if your symptoms improve. Artificial sweeteners, such as aspartame, saccharin, and sucralose, are often found in diet sodas, sugar-free gum, and other low-calorie products. These sweeteners can be problematic for people with IC, as they may irritate the bladder and trigger symptoms. If you suspect artificial sweeteners are affecting you, try eliminating them from your diet and observe any changes in your symptoms. Carbonated beverages, including sodas and sparkling water, can also be a trigger for IC symptoms. The bubbles and acidity in these drinks may irritate the bladder lining, leading to increased pain and urgency. If you notice a pattern between drinking carbonated beverages and your symptoms, consider switching to still water or non-carbonated drinks. Chocolate contains both caffeine and certain acids that can irritate the bladder, making it a double trigger for some people with IC. Additionally, sugary foods in general may also contribute to symptoms for some individuals. If you find that eating chocolate or sweets leads to discomfort, try limiting your intake and see if your symptoms improve. Processed foods often contain preservatives, artificial colors, and flavor enhancers that can trigger IC symptoms. These additives may irritate the bladder or contribute to inflammation, making symptoms worse. Choosing fresh, whole foods and minimizing processed items in your diet can be a helpful strategy for managing IC. Beyond diet, certain personal hygiene products can also trigger IC symptoms. Items such as scented soaps, bubble baths, feminine hygiene sprays, and even some laundry detergents may contain chemicals that irritate the sensitive tissues around the bladder and urethra. Opting for fragrance-free and gentle products can help reduce the risk of irritation and flare-ups. Wearing tight clothing, especially around the pelvic area, can put pressure on the bladder and worsen IC symptoms. Tight jeans, leggings, or underwear may increase discomfort and contribute to flare-ups. Choosing loose-fitting, breathable clothing can help minimize irritation and provide relief. While exercise is generally beneficial for overall health, certain physical activities can trigger IC symptoms. High-impact exercises, such as running or jumping, may put stress on the bladder and pelvic area. If you notice that your symptoms worsen after specific activities, consider switching to low-impact options like walking, swimming, or yoga. Sexual activity can sometimes trigger IC flare-ups due to friction and pressure on the bladder and surrounding tissues. Some people find that symptoms worsen after intercourse, while others may not be affected. Open communication with your partner and using adequate lubrication can help reduce discomfort and prevent irritation. For many women with IC, the menstrual cycle can be a significant trigger. Hormonal changes during menstruation may increase bladder sensitivity and lead to more frequent or severe symptoms. Tracking your cycle and being prepared for potential flare-ups can help you manage symptoms more effectively during this time. Emotional stress and anxiety are well-known triggers for IC flare-ups. The body's stress response can cause muscle tension and inflammation, which may worsen bladder symptoms. Practicing stress management techniques, such as deep breathing, meditation, or gentle exercise, can help reduce the impact of stress on your symptoms. Not getting enough sleep can weaken the immune system and increase sensitivity to pain, making IC symptoms worse. Poor sleep may also contribute to higher stress levels, creating a cycle that's hard to break. Prioritizing good sleep hygiene and establishing a regular bedtime routine can help improve both your sleep quality and IC symptoms. Staying hydrated is essential for bladder health. Dehydration can make urine more concentrated, which may irritate the bladder lining and trigger IC symptoms. Drinking enough water throughout the day helps dilute urine and can reduce discomfort. However, it's also important not to overhydrate, as excessive fluid intake can increase urinary frequency. Although IC is not caused by infections, urinary tract infections, UTIs, can trigger or worsen symptoms. UTIs can cause inflammation and irritation in the bladder, leading to increased pain and urgency. If you suspect you have a UTI, it's important to seek medical attention promptly to prevent complications and manage symptoms. Some medications, including certain antibiotics, diuretics, and pain relievers, may irritate the bladder or increase urinary frequency. If you notice that your symptoms worsen after starting a new medication, consult your healthcare provider to discuss possible alternatives or adjustments. Cold weather can sometimes trigger IC symptoms, possibly due to increased muscle tension or changes in circulation. Some people find that their symptoms worsen during the winter months. Dressing warmly and using heating pads can help manage discomfort during colder periods. Traveling or changes in daily routine can disrupt your usual habits, leading to stress, dehydration, or dietary changes that may trigger IC symptoms. Planning ahead, staying hydrated, and maintaining a consistent routine as much as possible can help minimize the impact of travel on your symptoms. Smoking is known to irritate the bladder and can worsen IC symptoms. The chemicals in tobacco can increase inflammation and sensitivity, making symptoms more severe. Quitting smoking is beneficial not only for IC, but also for overall health and well-being. Allergic reactions, whether to foods, environmental factors, or medications, can sometimes trigger IC symptoms. Allergies can cause inflammation throughout the body, including the bladder. Identifying and managing allergies may help reduce the frequency and severity of IC flare-ups. Exposure to certain chemicals, such as those found in cleaning products, paints, or industrial environments, can irritate the bladder and trigger IC symptoms. If you work with or are exposed to chemicals regularly, take precautions such as wearing gloves and ensuring proper ventilation. Allowing the bladder to become overly full can stretch and irritate the bladder lining, leading to increased pain and urgency. It's important for people with IC to urinate regularly and avoid holding urine for extended periods. Setting reminders or following a schedule can help prevent overfilling. Constipation can put extra pressure on the bladder and pelvic area, worsening IC symptoms. Maintaining regular bowel movements through a balanced diet, adequate hydration, and physical activity can help reduce this risk and improve overall comfort. Pelvic floor dysfunction, which involves tight or weak pelvic muscles, can contribute to IC symptoms. This dysfunction can cause pain, urgency, and difficulty emptying the bladder. Physical therapy and exercises targeting the pelvic floor may help alleviate symptoms and improve bladder function. Certain medical procedures involving the bladder, such as catheterization or cystoscopy, can temporarily irritate the bladder lining and trigger IC symptoms. If you need to undergo such procedures, discuss your IC with your healthcare provider to minimize discomfort and manage potential flare-ups. Hormonal fluctuations, such as those experienced during pregnancy, menopause, or hormone therapy, can affect IC symptoms. These changes may alter bladder sensitivity and lead to increased discomfort. Monitoring symptoms during hormonal shifts and discussing management strategies with your healthcare provider can be beneficial. Some research suggests that immune system dysfunction may play a role in IC. Autoimmune responses or chronic inflammation can increase bladder sensitivity and trigger symptoms. While more research is needed, supporting your immune health through a balanced lifestyle may help manage IC. While the exact cause of IC is unknown, genetics may contribute to an individual's risk. If you have a family history of bladder issues or IC, you may be more susceptible to developing symptoms. Understanding your genetic background can help you be proactive in managing potential triggers. Environmental factors, such as exposure to pollution, allergens, or harsh weather, can sometimes trigger IC symptoms. Being mindful of your surroundings and taking steps to minimize exposure to known irritants can help reduce the likelihood of flare-ups. Physical trauma or injury to the bladder, such as from accidents or surgeries, can increase the risk of developing IC or trigger flare-ups in those already diagnosed. Protecting yourself from injury and discussing any trauma with your healthcare provider is important for ongoing management. Living with other chronic illnesses, such as fibromyalgia or irritable bowel syndrome, can increase the likelihood of IC flare-ups. These conditions may share underlying mechanisms, such as inflammation or nerve sensitivity, that contribute to symptom overlap. Managing all chronic conditions holistically can help improve overall quality of life. Bladder installations, a treatment for IC, can sometimes temporarily worsen symptoms before improvement is seen. The introduction of medications directly into the bladder may cause irritation for some individuals. It's important to communicate with your healthcare provider about any changes in symptoms during treatment. Major surgeries, especially those involving the pelvic region, can trigger IC symptoms due to tissue trauma and inflammation. Recovery may take time, and symptoms may temporarily worsen before improving. Working closely with your medical team can help manage symptoms during the recovery process. Some diagnostic tests or treatments involve filling the bladder with liquids or agents to assess function or deliver medication. This process can temporarily irritate the bladder and trigger IC symptoms. Discussing your IC diagnosis with your healthcare team before such procedures is important for minimizing discomfort. Bladder stones can cause irritation and inflammation, leading to increased IC symptoms. If you experience sudden changes in your symptoms, such as severe pain or blood in the urine, it's important to seek medical evaluation to rule out stones or other complications. Some treatments for bladder cancer, such as chemotherapy or radiation, can irritate the bladder lining and trigger IC symptoms. If you are undergoing cancer treatment and notice increased bladder discomfort, discuss symptom management strategies with your oncology team. Any source of bladder inflammation, whether from infection, injury, or unknown causes, can trigger or worsen IC symptoms. Reducing inflammation through lifestyle changes, medication, or other therapies can help manage symptoms and improve quality of life. Increased nerve sensitivity in the bladder and pelvic region is thought to play a role in IC. This heightened sensitivity can make the bladder more reactive to triggers that might not affect others. Managing nerve pain through medication or therapy may help reduce symptoms. Despite careful management, some IC flare-ups may occur without an obvious trigger. The unpredictable nature of IC can be frustrating, but keeping a symptom diary and working closely with your healthcare provider can help identify patterns and develop effective management strategies. Managing IC triggers involves a combination of lifestyle adjustments, dietary changes, and working closely with healthcare professionals. By identifying your personal triggers and making targeted changes, you can reduce the frequency and severity of flare-ups. Remember, every person's experience with IC is unique, so finding what works best for you is key. In summary, interstitial cystitis can be triggered by a wide range of factors, from dietary choices and personal habits to environmental exposures and medical conditions. While managing IC can be challenging, understanding your triggers and making informed choices can greatly improve your quality of life. With the right support and strategies, it's possible to find relief and regain control over your symptoms.